Hello, my name is Dr. Jeremy Sammut and I'm a Research Fellow here at the CIS. I'm going to spend the next few minutes outlining my new Target 30 report, Saving Medicare but Not As We Know It. Target 30 is our new campaign that aims to reduce the size of government to below 30% of GDP in 10 years' time. My report is the third to be released this year and discusses the financial problems facing the health system in an ageing Australia. It suggests a number of strategies that state and federal policymakers can implement to create a more cost-effective and sustainable health system. Thanks to the intergenerational reports, we know that rising health costs are set to unsustainably increase government spending in coming decades. Without tax hikes or higher public deficits and debt, governments will not be able to pay for the much higher cost of Medicare. There is a real possibility that health-driven financial pressures will force government to cut public health and other services. This will mean that Australians of all ages will be denied healthcare that governments won't be able to fund. Despite these challenges being well known for at least a decade, the policy response has been next to negligible. This was mainly due to Medicare being a very popular program and a political sacred cow which politicians are reluctant to touch. Hence there has been little interest in reducing the government share of health spending and increasing private financing of health services. My report shows how urgent it is to start the national discussion about the alternatives to the current Medicare regime. The takeaway is that the few policy initiatives that have tried to shift health costs off government budgets have not been successful. The Howard government's private health reforms of the late 1990s have failed to water the balance between public and private health funding. My report shows that since 2000, non-government health expenditure has increased from 2.7% of GDP to 2.9%. However, this was far outstripped by the 0.8 increase in government health expenditure. Extra government spending on health, which has increased by 80% in real terms, has been mainly responsible for increasing total national health spending from 8.2% of GDP to 9.3%. These trends are a sign of the long-term challenges we face. My report therefore argues that it's time to start cutting Medicare down to size to reduce the burdens that runaway health spending will otherwise impose on future generations. We need to boost the efficiency of public health services, better target public health spending, and expand the role of private health funding. Policies that should be implemented include downsizing the health bureaucracy and privatising select public hospitals to improve productivity. We should also look at reintroducing the Hawke government's short-lived Medicare co-payments and should means test Medicare consistent with the means test for the private health insurance rebate. These are just some of the 10 health tips to Target 30 canvassed by my report. However, it also proposes big bang health reform. Medicare is a pay-as-you-go health system. Every health dollar collected by the government each year is spent in the same year and nothing is saved and invested to pay for future health costs. We need to shift to a save-as-you-go system. I'm therefore proposing that generations X and Y should pre-fund future health costs over time. We should reconfigure Medicare spending into two new streams of funding for superannuation-style health savings accounts and high-deductible private health insurance vouchers. This would allow the old Medicare to be transformed into an age-limited program for the current generation of retirees or near retirees that can be abolished when the self-funded system matures. Making the health system sustainable is about setting the right priorities now. One of the ways we could fund what I've called the new Medicare is to not increase compulsory superannuation contributions from 9% to 12% of income by 2019. The federal government's own report into the retirement income systems found that this was not needed to ensure the sustainability of the old age pension. This money would be much better used to establish millions of personal health savings accounts and reduce the money that governments will otherwise have to spend on future health needs. The predictable and lazy response to the kind of reforms I'm proposing will be that they will take Australia down the expensive and socially unjust US healthcare path. My report has anticipated these criticisms. It shows in detail how and why the new Medicare will improve the fairness of the health system by addressing some key flaws in the existing Medicare scheme. My report and the snapshot summary are available at cis.org/target30. Thank you.